My name's Dr. Helen Lowell and I'm a GP in Leeds, and I'm the Lifestyle Medicine Lead for One Medical Group, and I was delighted to welcome Get Set Leeds to our surgery in Bermontoft's Shakespeare Medical Centre. So there were 4 main themes that came up from the conversations that Get Set Leeds had with our patients at Shakespeare Medical Practice. So family and work responsibilities and that perception of not having enough time to be more physically active, having a health condition, being in pain or maybe having a disability, not knowing where to go to access information on how to be physically active locally, and lastly, doctors, nurses and healthcare professionals not bringing up physical activity in conversation with patients. So family, work responsibilities and time was one of the themes that came up, and actually that's something that I hear most commonly from patients. You know, life gets in the way, life's busy, a lot of us are juggling both work and family commitments at the same time, and we can feel that exercise or physical activity just feels like an extra thing on the to-do list. And my advice would very much be that physical activity doesn't have to be an extra thing, and if we can think of ways to gradually build it into what we're already doing on a daily basis, it won't feel like a chore. So my advice to anyone that feels that they don't have time or that their life's very busy is, first of all, start very gradually, and every little helps. Even just doing 10 minutes a day here and there will have a benefit to your health and your well-being. If we can make physical activity part of family life, it's not going to feel like an extra hassle. So playing in the park with the kids, playing sport together, going for walks together, it's not going to feel like an extra thing that you have to do by yourself. It's also going to make it more fun and enjoyable and benefit both you and your children. Don't forget that most forms of physical activity are free and cheap and easily done. Walking, gardening, taking the stairs, and these all have great benefits for health. One of the themes that came up is for patients who do have a health condition or perhaps have pains in their muscles and their joints or have a disability, not really knowing if they can exercise and what sort of exercise they should be doing. It's really important, especially if you have a health condition, to exercise, and it's safe to do so. The key message there is to build it gradually, seek advice from your doctor or your nurse, and actually we know there's great evidence to show, for example, that exercising can reduce pain and stiffness in joint conditions, and it reduces a number of health conditions. There's a 40% reduction in your diabetes risk, it reduces your risk of dementia by 30%, and reduces your risk of joint and back problems as well. So it really is beneficial, even if you have a health condition. Some of the patients had said that they felt that they didn't really know how to access physical activity in their local community, and actually it's just to reassure them and say there's lots going on in local communities in Leeds. One of the ways you can access more information is by going to the Get Set Leeds website. There's loads of resources there that will signpost you to where to go. And the second website is the Active Leeds, and on there you can where your local leisure centres are, what exercise classes are on, and also what specific physical activity programmes are available if you have a health condition or a disability. Healthcare professionals that the patient's going to see don't perhaps bring up physical activity and aren't offering advice to patients. So 3/4 of GPs feel that they don't have the time to have these conversations with patients, but it really only does take a minute. And there are some great resources out there to help healthcare professionals and support them in having these conversations. My favourite one is the Moving Medicine website. There's also a great initiative from the Royal College of GPs called Active Practices, and this is to encourage staff within GP surgeries to be more physically active themselves, but also to have conversations more with patients and actually prescribe exercise to patients. And at One Medical Group, I'm currently working on delivering training to our staff to do just this, to support them in prescribing physical activity to our patients. So I do hope that patients at Shakespeare Medical Centre and all our GP practices will feel that they are being talked to more about physical activity in the near future. There are so many benefits to being more physically active. Even if you're just increasing your physical activity by 10 minutes a week, you're going to get benefits from this. So it improves overall well-being, it reduces stress, it can boost your mood, can help us maintain a healthy weight, and in general helps us live longer and better. I'm really pleased that Get Set Leeds came to Shakespeare Medical Practice and were able to have these conversations with our patients. I just want to say thank you to the patients that did share their opinions and views. It's going to be really helpful in making Leeds a more active city. For more information, go to getsetleeds.co.uk.